Thank you very much, everybody. It's fabulous to be here. It's great to have the first session after the gala dinner as well. There's an awful lot more of you out there than I expected, so this is a great start for me. Oh, I've got a clicker. That's good news. It's lovely to be here. This is my second ASPiH, and I was reflecting this morning on sort of the experience of coming here this year and last year, and how that compares to other experiences going to quite a lot of conferences that I've attended. And one of the things I noticed particularly about coming here is a fabulous sense of community that exists within people working within simulation across the country. And so it's just fabulous to see. And part of that is I know that patients and public are at the centre of that. And it's a real benefit to all the work that you're all doing. And that therefore is a pleasure for me to then start to become involved through the work I'm doing at HEE with people working around simulation-based education. So I'm going to tell you a little bit about what we're up to in the Technology Enhanced Learning Programme at HEE. Kicking off, hopefully most of you are aware of HEE as an arm's length body and what our role is in the system. Occasionally there are some people out there that haven't heard about what HEE does. And this is a chance to give you a little bit of some news on that really. Its primary role is around the training of the workforce that we have at the moment within the NHS in England, but also the supply and the training of that future workforce as well. And as we know, in the NHS at the moment, and actually at all points when we're considering making sure we've got the right workforce with the right skills in the right place, that is always a significant problem to overcome. And that problem is partly because we've got enormous scale, over 1 million people working, hundreds of different roles that people work in, and a significant mission to deliver that best quality of healthcare to the public in our country. And one of the roles we're facing, of course, is in increasing population, change in demographics, change in demand for healthcare, and as we know in terms of the work going on the long-term plan that you might hear about, or the work that went into the 5-year forward view, all of those things are looking to try and solve some of those wicked problems and square that circle. We know ostensibly that in terms of the pipeline of training that's coming out, by about 2027, there's something like 72,000 people that we could train if we continue to do the things that we do now and the way we do them. But actually, when you model, if we were to be delivering care in the way that we deliver care at the moment, and you extrapolate how many more people we need to meet that population needs and healthcare demand, we're looking at nearly 200,000 people. So all of that conversation about having to change the way we do things is fundamental to be able to effectively meet the demand that's going to be required. And the education and the training of people, the way we deliver education, the way we support people to maybe deliver care in new ways, find new ways of working, is absolutely fundamental. And all of you here, all of you that are part of delivering and designing and evaluating simulation-based education, I think are fundamental to this crucial mission. And of course, we can't forget there's a huge number of people that actually are there delivering the healthcare that are not directly employed. What are we doing about including volunteers and carers, etc.? And Margarita and I were just having Helen actually have a conversation about there being patient advisors that are part of ASPiH. Well, that's really, really crucial. We've got to connect with the people that we're there to serve, really, because all of them are equally part of that delivery. So the TEL programme at HEE, so I look after the national programme, but we're actually part of a wider team. So there's sort of 5 teams around HEE. We've got a national programme, there's 4 regional teams, and we work together. And this is the sort of strap line that we've got in the national team. Our purpose really is to support that workforce education and support them being able to utilise the most effective evidence-informed technology and techniques. So we're doing that. through kind of three ways, really. One is our work that we're doing, we're growing in terms of sim. We've also got a great deal going on in terms of how we utilize digital and the internet. And also, we've also got a role to be looking forward, looking ahead, to be thinking about, in terms of the technology and its capabilities that are emerging, how can we best employ that in a way that's going to benefit patients and learners in the NHS? Now, hopefully, all of you are aware that about a month ago we published this document on our website called the National Framework for Simulation-Based Education. I'm not going to ask you to put your hands up, just through the fear that only about 3 people will put their hand up, and that'll include Bryn and the 2 colleagues there. But marvellous. So I'm extremely proud of the work that's gone into this. This for me is, I think the team around it is sort of hopefully starting to up a new way forward for the profile, and what we hope is the support for you guys to deliver the most effective simulation-based education into the system, again, to kind of deliver on that mission that I was setting out before. So we've got a vision encapsulated in this. We've got a lovely graphic that sets out the 5 principles. Our vision, if you're not aware of it, is that Health Education England will ensure development of a well-trained, engaged, multi-professional workforce that is able to deliver safe, effective care by utilising meaningful and cohesive simulation-based education. It's a little bit of a mouthful. We worked through a number of them, actually, but we just wanted to capture all the kind of key points. This sort of, I think, you know, what's for me is great is this gone through our executive directors. People are happy. We're setting out, I think, a bit of a marker there to say we've got a commitment into this. We're sort of, you know, we're sort of being open with that commitment to acknowledge the role that simulation-based education will play, and that there is work to be done to continue to support, enhance, and embolden that. So sitting within this are our 5 key principles. We've set out in the first instance a framework with principles and not a strategy, because we didn't think we're at the right place, we're at the right point to be developing a strategy. In fact, our view, our analysis was that we are at a point where we need to start to really understand what's going on out there and start to bring everybody together and start that conversation. But we wanted to do it aligned to the things that we think are important to shore up and embolden that delivery. And this is really all linked to quality, accountability, and the governance around those. I'm not going to read out each principle, so quite like you to go off and do your own homework if you haven't got a copy already, or look on the website, please, and have a read. We didn't do this in a darkened room, and that was extremely important to us. We did this through setting up, or sort of reinvigorating a group and slightly changing it a bit that had sort of been around for a while, because I know some of this is conversations that have been going on prior to my tenure in this role. But we set up a wider simulation reference group. We wanted to make sure we were talking to all the people that had a stake in this in the HE local offices, that are part of the deaneries or the multi-professional training delivery, and also people that they're connected to through simulation networks in the sim centres. So this was achieved really through a year of conversation and discussion and negotiation, and some data collection as well. We were asking what the local offices were up to, what they're investing in, how HE money is being spent, and how they, you know, how are they delivering, how are they measuring quality, what do they do to evaluate, etc. And of course, what was also important to us is that this is being considered as with a multidisciplinary approach, that this is for everybody to benefit from. And that's led to us creating this framework, and then some light touch KPIs, key performance indicators, which we'll now start to ask. We're starting to ask the offices to report back to us on. Now, over the course of the next year, what we'll be doing is really starting to get that greater detail around what's going on. Where are our local regions in regards to these 5 principles? And then what can we start to do in our role? Our role is to facilitate and enable and coordinate and manage that interface with the policy and all the other bits of HE. But what are we then going to do to harness that community to hopefully be able to walk towards a big comprehensive and even bolder strategy for the country. We've created some videos as well. We think that actually, because there's such a wide spectrum of simulation-based education, because it can be deployed in so many different kind of contexts, we think that we want people to become more familiar, to want to open their eyes up to the possibilities. Part of that is developing some films that we can start to share out. We'll keep building on this catalogue. Some of you have very kindly contributed to the creation of these films, which we're very grateful for. So we're also, as with anything, when you start a new project, all of a sudden other projects start to open up. What our clinical leader, Chris Munch, who's sitting over there, sometimes describes them as illegitimate offspring of the main project, which is our joke, isn't it, Chris? But they're really important, because what this is doing is just stimulating kind of ideas and creativity, and think about what's our role around this. So a thread running through this is that this is not about investing millions of pounds more necessarily in new equipment, but actually it's about making best use of the equipment we've got. And one of the things we want to emphasize is actually investment in the people who are involved in delivering simulation. So supporting the faculty, developing the faculty is a really key thread actually that we want to communicate through this framework. But we are interested in kit a bit as well. We're certainly interested in terms of how the people applying new technologies. So we're equally doing some work around the application of mixed reality or virtual reality and using Google Glass and things like that. And also, what can we do in our role in HEE to support other people when they're making decisions about these things? So people working with somebody called Chris Perez, Nick Perez, sorry Nick. I know he's not here, but he might watch this. My apologies, Nick. In the virtual reality lab that we've supported through HE at Torbay Hospital to develop some guidance for hospitals when they're starting to think about if we're going to do 360 video, if we're going to invest in virtual reality, what do we need to know? Here's somebody they're all familiar with, Birthday Boy, I think at the moment, engaging in his own virtual reality. Now we've got our own royalty in the programme, and I think some of you met yesterday. Now, before I move on to digital, this has been a real team endeavour. We've had great involvement from within the wider project team, all of the people at ASPiH, all of the people out in the sim community that have helped us create this. But this would not have been possible without a great deal of blood, sweat and not tears, thankfully, from a wonderful project manager. And that's Suki Shin, who's sitting just down there. So thank you ever so much, Suki. We would not have got here. We wouldn't have been able to publish this without all the work that you've put in. So, digital stuff. So this is also a big deal for us. We know that people are increasingly utilising the internet to be able to engage in some learning, but they're doing it in all sorts of different ways. All that sort of world is emerging. People are making great use of their smartphones. Some people are doing it at home, some people do it at work. When people are doing it at work, unfortunately, a lot of them are still faced with rather challenges around IT, but we know that stuff's going to change over time. And of course, with technology, the pace of innovation is accelerating. When we got 5G, when we're, all this stuff, forget it, all that IT Wi-Fi infrastructure will just be having this incredible experience over 5G. Well, we really have to up a game if we're doing anything on digital. But at the moment, we're the custodians of e-learning for healthcare. I hope you're all familiar with that. If you're not, please go and have a look, which is an enormous program of e-learning, been around for nearly 15 years. And is absolutely massive. And I'm just going to blow its trumpet. I do apologise. But it's quite a significant thing out there. And I'm doing it not because I just want to show off about something that we have at HE that's not, I haven't made a significant contribution to it being built, so I at least feel comfortable showing off in that respect. well, it's over 800,000 people, so nearly all of the workforce in the NHS are directly accessing it from our hub, the NHS Healthcare Hub. Huge amounts of people are launching sessions, which is great. But actually what this is, it becomes a great platform to be able to work collaboratively to create great e-learning and to be able to get it out to people. So when we're looking at what sort of learning do we need that might complement or supplement some simulation-based education, we're interested in that. How do we take that blended approach? What can we do? What are we doing when we're looking at projects that, I know Bryn's spoken about one yesterday, were to support and develop faculty. We think this is one of the modalities where we can use to help do that. That's supposed to have an animation, but it goes on for a while, and I talk quite a lot, so I'm actually going to not do that. But one of the principles we have is really around the democratization of this stuff. So we let people access it through all their own learning management systems as well. Fundamental to our core principles is we just want people to access the best kind of educational support that they can. We're not going to put unnecessary barriers in the way. But we also know in talking to people that people really want to utilize some of that technology of Web 2.0. So they want to start to access different kinds of resources, but they want a way of finding that through some sort of system that gives them confidence too. Whether that's YouTube videos, podcasts, documents, articles, session plans, you name it. And people want to share their own stuff. People are creating the most amazing things, amazing resources in their localities. And sort of touching right back to what I said, that incredible altruistic community spirit, for instance, that exists within simulation. We want to be able to leverage that. I want to give people the tools or complement existing tools out there to be able to share, connect, and innovate together. So we're building a new platform. We're evolving the eLearning for Healthcare Hub into something at the moment is called the Learning Solution. I don't know if any of you have ever been involved in a project where you have to find a name for something. This is a revelation for me, and I don't know in these lights if you can see the grey hairs, but I didn't have these a few months ago. So this is going to be, I think, an exciting platform. So this is a place where people can go and do some learning, but also people can share. It will also be a place where people can create communities of practice, where we can stimulate discussion and review of content as well, and collaboration. We can go across geographical boundaries, technical boundaries, all on a platform where people are going to feel like they can have confidence in the infrastructure and their support behind it to help make sure. And also built on a very sophisticated architecture, so we know over time we can start to do things like personalization, we can use machine learning, we can deliver what we hope is a really good user experience. So that's very exciting. So this is still linked to simulation, because immediately we're working with people within your community to help us in the private beta phase. So before we launch it as a public thing everyone can see, it's a closed group, and we've got numerous different groups, and one of the groups that we are engaging with to help us build this, because you do it through an agile process, you build new features, to design it, you test it, you then continue to iterate. So hopefully what you get is something that really works for people. And we think because of the jobs you guys do and the level of interest you have in trying to make a difference and innovate and drive things, that would be a really helpful private beta partner to help us in the building of this. Right, so I'm nearly done. One of the last thing that I suppose we engage with, and this is that kind of putting that finger in the air and thinking ahead to, okay, so we understand largely some of the big innovations that are out there. These are the sorts of things that have been a while, and if anyone's ever seen this thing, it's called the Gartner hype cycle. In the middle, I don't know if you can read it, going back, there's the most amazing phase of technology when they're all slipping into the trough of disillusionment, where the whole hype has gone from, oh, this is going to be absolutely amazing, imagine what we can do with this, to, oh crumbs, I can't actually find a practical application of this yet, or the internet isn't fast enough to make it work. So that's a wonderful terminology to point out to you. So we utilize these sorts of things, and what we do again is we engage in just our role to facilitate and enable. So we work across the ALBs, and we pull people in from the Royal Colleges and other people in our communities to engage with us to think, what are we going to be seeing in terms of the use of 3D printing? How's that going to be helpful? I suspect some of you in the room are already utilising these technologies. What's the Internet of Things going to bring? What's the ability to work big data, to start to triangulate with different data sources? What's that going to mean, and how's that going to apply to education? Hopefully what we get is we emerge some useful kind of insights, and it gives us some indication of where we may want to start to invest a bit of taxpayers' money to do some research, to do some understanding for the wider benefit of other people. Or how do we create communities around this? We don't want to be caught out, basically. We've got a role to do that. I don't know if anyone has heard of Eric Topol as well. This is a clinician over from the States. He wrote this book a couple of years ago. He was commissioned by Jeremy Hunt when he was Secretary of State to do an independent review of what will the impact be on emerging technologies in terms of what we need in our workforce. So this Topol review has sort of had a home with an HE, and that's going to publish in the new year. We think that's going to be really interesting. So I wanted to tell you about it in case you weren't aware of it, because I think when we see that in the new year, it's going to lead to further ramifications in terms of everything that we're all up to. So that's the end of my kind of sort of romp through the things we're involved in terms of technology enhanced learning in HEE. I think the last thing to say really is please do keep in touch. Multiple ways you can do that. Hopefully, if you haven't visited our stand, then whilst you're here at ASPiH, then also please do that. And thank you very much for such a sort of a warm welcome at ASPiH 2018.
Thank you very much. Are there any questions?
This is also the benefit of preceding the gala, isn't it? We would have the energy to. Well, thank you very much, everybody. Come and find me. I'm around for the rest of the morning. Unfortunately, I have to shoot off. But if you do, please do come.